Hello, everyone, and welcome back to the Meet the Member series. Today we have with us gMendel. So please, could you introduce yourself and tell us about your company?
Hello, Julia. Thank you for giving me this opportunity to talk about gMendel. My name is Dimitri, and I am medical representative of gMendel, which is a Danish biotech aiming to transform the diagnosis of genetic disorders for better disease management.
Hey.
You know, there are 350 million people worldwide who suffer from genetic disorders. Accurate diagnosis remains a long and painful process that takes 7 years on average. Well, even with dozens of medical examinations, 40% of patients are still misdiagnosed. This creates a challenge for the patients, doctors, and healthcare systems, and the life cost can reach 2 million euros per patient. So our ambition is at gMendel to democratize diagnosis for genetic disorders and improve the outcome for the many families living with the insecurity of not knowing what causes the symptoms their child lives with.
Wow. Okay, and what makes your company stand out from the others?
Well, today the diagnosis of genetic disorders relies on a set of conventional techniques which are not accurate. Advanced genomic technologies have been changing the landscape though, but the translational gap to clinical implementation has not been bridged yet, mainly due to high cost and complexity.
Yeah.
gMendel technology combines genomics, machine learning, and blockchain. And in this point, I would like to show you a graph of our technology.
Okay.
So in that way, gMendel provides a shorter, safer, and more economical path to accurate diagnosis. At the same time, we ensure the highest security and patient data encryption. Our method relies on multi-level multiplexing, DNA sequencing, and demultiplexing of barcodes, through which we perform genetic disorder classification and detection of a large number of samples at a time. Vivea platform employs, our platform you see here on the screen, employs customized deep learning architectures at all levels of the learning process, from feature extraction to assessment and follow-up care. Following a multi-model fusion strategy, the outcomes of the individual models are combined into a single and accurate medical decision.
Okay. And well, let me ask you, what has been your company's biggest success or biggest failure?
Well, I believe, Julia, that all things can be reimagined and that innovation emerges through collaboration. And well, let me stop sharing here.
Okay.
All right. I believe our biggest success so far has been building a robust ecosystem through partnerships and collaborations.
Okay.
Because of our ecosystem, we're about to certify in a record time, just in 1.5 years, our first product, gMendel test for detection of Klinefelter syndrome. Of course, this will be followed shortly by the most common aneuploidies and microdeletion syndromes. This certification proves that our technology works and our organization has matured, while we are preparing for the release of fully fledged products in the market. Well, you ask me about our biggest failure. You know, at gMendel, we don't believe in failures, but in delayed successes. We certainly had many challenges since we started in 2020. Probably the biggest challenge is to find samples for our tests and hospitals to participate in our pilots.
Okay. And well, let me ask you, what made you join Barcelona Health Hub?
Well, we were intrigued by the mission of Barcelona Health Hub, which is to become a global reference for digital health, linking startups, health organizations, companies, and investors. You know, we cannot transform the diagnosis of genetic disorders alone or with our current ecosystem. We joined Barcelona Health Hub in order to strengthen our ecosystem. We know that Spain has great scientists, entrepreneurs, companies, and state-of-the-art hospitals. So we hope that through Barcelona Health Hub, we can enhance our ecosystem.
Okay. And what do you expect from us towards the future?
We hope that you can introduce us to your ecosystem, and your ecosystem, Barcelona Health Hub ecosystem, become our ecosystem. We hope you can introduce us to hospitals that can become pilot hospitals for our technology. Also, we need investments because, you know, so far all funding came from the co-founders. So we hope you can introduce us to some investors as well. We hope that through your ecosystem, we can get a step closer to our ambition. And what is our ambition? Is to democratize diagnosis of genetic disorders and improve the outcome for the many families living with the insecurity of not knowing what causes the symptoms the child lives with. This is what I stated before, but it's very important for us, you know, and this is what we are trying to achieve through our rapid, scalable, reliable, and accurate technology. We expect to make a significant impact on people's lives and can help the health systems realize sizable savings, as well as to create healthy revenue base through our market share of the global market for diagnosis of genetic disorders, which is expected to reach 60 billion euros by 2030.
Wow. A big number.
A big number, indeed.
Well, is there anything else you would like to tell us?
Well, just to finish my interview about gMendel, what about our objectives is something I wanted to say is that we're really looking forward to any collaboration that Barcelona Health Hub can connect us with. And in that way, as I stated before, I say it once again, to get closer to our ambition. I said it before, we want to democratize diagnosis for genetic disorder. That's it.
Okay, well, hopefully we can meet soon and do activities together and create a collaboration.
That will be our pleasure indeed.
Okay, thank you very much for your interview. And yep, thank you.
Thank you very much, Julia, to you too, and to Barcelona Health Hub for giving us this opportunity to talk about gMendel.
Of course, thank you.